Now, most people use a fitness monitor to count how many steps they take, but for one Melbourne grandfather, his Fitbit saved his life.
Yeah, the device picked up a serious heart condition that the doctors missed. Mick Schroeder joins us now, thankfully, with one of the cardiologists who saved his life on the table, Dr. Stuart Healy from MonashHeart. Welcome to both of you. Mick, let me start with you because a lot of people are now picking up these bands. They're used for fitness, but your daughter gave one to you for a different reason. So what did she give it to you for?
So she can follow me around. If I dropped on the ground, she can find where I was. That was the main thing she got it for.
So she's using the GPS tracker to see where you are and if you're okay? That's
right. She was more or less tracking wherever I went.
That's a lovely, caring thing for her to do. But it turned out to be a blessing in disguise because you were virtually a heart attack waiting to happen. So what did your Fitbit discover?
That my rate was pretty high. I think it was 218 down to 47, and the daughter showed it to the local GP, and that's when it all started to happen.
Wow, that's a bit of a variation, isn't it, in numbers?
It is. Dr. Stewart, I want to bring you in here because when Mick went to the GP, they couldn't see an issue with his heart rate. But isn't it extraordinary that this device that a lot of people are now buying and picking up found something that a regular GP couldn't? So why was that? Was that an anomaly?
Look, it's a good question, David. One of the issues with the technologies now is that a lot of these heart rhythms are very intermittent. They only last sometimes seconds or minutes. And a picture in time, which is often what we get as a consult, doesn't actually tell the true tale. These devices now enable us to monitor people for 24/7. And in fact, in Mick's case, there was several episodes of fast heart rates, but in between times his heart rate was normal. So it can be very hard to pick these up. And in fact, in some people, we actually put in long-term loop recorders under the skin that are medical devices to follow patients up like Mick. In this case, though, the Fitbit did the job.
Wow.
And while he was sitting in the doctor's office waiting for a referral, the Fitbit went crazy again. Do you think if Mick had waited for a more in-depth examination, he might not have been so lucky, Doctor?
It's an interesting question with this fast heart rhythm that Mick had. Mick had a rhythm called ventricular tachycardia, and it became what we call incessant, where he was in it more often than he wasn't. And the trouble with that is it can lead to more life-threatening rhythms, which is called ventricular fibrillation, which in fact kills a significant number of people with weak heart muscles, and in Mick's case could have led him to die suddenly. So yes, there was an emphasis on time, and Mick got very timely treatment through MonashHeart because of the Fitbit.
And what treatment was that? What did you have to do to Mick, Dr. Stewart?
So Mick was in hospital for several days, and first off there was one to make the diagnosis, which is done on an ECG, which is a more complicated form of Fitbit, if you like. And then from there, it's usually several days of medications to see if we can settle this rhythm down. And in fact, Mick's case, we were very strongly considering as to whether or not we should go inside the heart, find the circuit that was creating this rhythm and try and ablate it and fix it. But thankfully, Mick, with good medical care through MonashHeart, his heart rhythm settled down over a few days. Ultimately, he needed, though, a device which we use in people with weak heart muscles with this rhythm to prevent them from dying suddenly, called an implantable cardiac defibrillator.
Is that what we would call a pacemaker?
It is similar to a pacemaker. It has a pacemaker-type function, but it also has a very special capability whereby there is a special battery in it that can actually shock the heart back into rhythm. So it watches your heart 24/7, and if it detects a fast heart rhythm, it will actually charge up and initially try and pace your heart out of it, but eventually, if it can't do that, it will actually shock you.
Amazing. Incredible, the technology. And speaking of, Mick, I mean, would you recommend that everybody wears a Fitbit these days?
It's a difficult question that the medical industry itself is wrangling with at the moment. What we're seeing is rapid expansion of technologies before we actually have scientific evidence to say that's the right thing to do. I think the take-home lesson from Mick is that if you are conscious of your health, and that is taking your pulse, taking your blood pressure, and you have symptoms, you should report them to your local medical officer or your GP, who can then subsequently order medical tests that can confirm or refute the diagnosis, for example.
Well, Mick, Dr. Stewart, thank you both so much for joining us today. I think Fitbit sales just went through the roof this morning. We really do appreciate your time. And also, if you are feeling a little bit uncomfortable in any way, shape or form, please see your GP.
Absolutely. Still to come, the world's greatest talk show queen today, Oprah, is sharing the secrets behind her latest slimming success.
Last one.